Tennessee's top vaccination doctor fired. She says it's because she was trying to get COVID shots to teens. Dr. Michelle Fiscus wrote a memo about a Tennessee state law that says teens can be treated without parental consent. She was fired, and the Nashville Tennessean is reporting that the state stopped vaccine outreach for kids after that altogether. Dr. Fiscus joins me now. She's Tennessee's now former medical director for vaccine-preventable diseases and immunization programs. Dr. Fiscus, thank you so much for being with us. The mature minor doctrine, it's a Tennessee state Supreme Court decision from the 80s that says that teens ages 14 to 18 can get treated without parental consent. How are you trying to use that, tap into that to get teens vaccinated?
Well, really, we weren't trying to use that to get teens vaccinated. Where this arose from was outreach from our COVID-19 medical providers, COVID-19 vaccine medical providers, who were questioning where the rules were around providing vaccines to minors who might present themselves to be vaccinated without a parent. So a 16-year-old who might drive up in a drive-through vaccination site, and whether or not they were legally allowed to vaccinate those kids. I reached out to our Office of General Counsel at Department of Health. He provided me with what he said was forward-facing information posted to the TDH website, blessed by the governor's office, and that I could share in any way that I felt necessary. And I dropped that language that I was provided into a memo that went only to our COVID-19 vaccine providers, letting them know where the guardrails were on vaccinating minors. As you said, this is a 34-year-old state Supreme Court ruling allowing children ages 14 and older, if thought to be mature enough to make the decision, to seek medical care without the consent of their parents. And you know, it's not for me to interpret those laws or say whether or not it is or is not appropriate for 14-year-olds and older to do that. It is the law, case law in the state of Tennessee, that those individuals have that right. And I was sharing a factual memo with medical providers to let them know where the guardrails were.
So let me just make sure I have this in simplest terms. You were asked by medical providers who were concerned about whether they could give teens the COVID shot if they came to get the shot without their parents' consent. You pointed out a law in your state or a Supreme Court ruling in your state that said, yes, between 14 and 18, they can. Is that correct? You're just answering that question.
That's correct.
So let's talk about then what happened to you. We reached out to the Tennessee Department of Health, and a spokesperson there said, we cannot comment on HR or personnel matters. It is important to note and to be clear, our vaccination efforts have not been halted or shuttered. We are simply taking this time to focus on our messaging and ensure our outreach is focused on parents who are making these decisions for themselves and their families. So you are clearly no longer in the position that you held. Why were you told that you were being terminated? What happened?
Well, on Monday, I was invited to a meeting with the state's medical officer and a member of the Human Resources Department at TDH, and given an option of two letters. One was a letter of resignation that had been written for me that was awaiting my signature. The second was a letter from the commissioner stating that my executive appointment had expired, and I was asked to choose between them. I chose to allow my executive appointment to expire, as I had done nothing that would warrant my resignation from a job that I very much enjoy doing. And you know, this is on the heels of a legislative Government Operations Committee meeting on June 16th, where legislators called for the dissolution of the State Department of Health because of the memo that I had sent out and because of some Facebook posts that had been put out by the governor's office that stated that children 12 and older were eligible to be vaccinated against COVID-19. That was followed by the decision of the Department of Health to no longer provide any kind of vaccine outreach around COVID-19 for adolescents, and then quickly devolved into no messaging whatsoever around any kind of immunization for children. This while we're at back to school time, coming into flu season before too long, and behind by tens of thousands of vaccines for children for diseases like measles, because they weren't able to get vaccinated during the pandemic.
All right, so just to make sure I have this clear again, you were given two papers, either to let your position, your appointment run out, or to choose to resign. So basically, you're going to get let go this way or that way. And since then, it sure sounds like there isn't a whole lot of interest in getting eligible young people in the state vaccinated. I'm having a hard time understanding why you wouldn't want to get vaccines to people in a state where they might need it. We have 48% of the U.S. population fully vaccinated. In Tennessee, only 38%, lagging behind quite a bit there. What are the specific challenges in your state? Why are they having a hard time getting folks to get the COVID shot? And what are you hoping the health department will do here now, even in your absence?
Well, it's interesting. You just ran that story on Utah, another red conservative state, but where they have a governor who is very outspoken about the importance of getting vaccines, and their vaccination rate is nearing 70% for their eligible population. So it's interesting the difference when you compare and contrast Tennessee. What we've had here is a lack of leadership and messaging around the importance of getting this vaccine to stop the pandemic. We have never had a mask mandate here before the vaccines were available. Vaccines are presented as, something to be considered, but not necessarily encouraged. Department of Health has been told that it's not our job to encourage people to get vaccinated, but only to make vaccines available to them. I think anyone in public health knows that a large part of the lift of public health is educating the people in their jurisdiction so that they can make good informed choices. And in the absence of that type of science-based messaging, you start to get a lot of anti-vaccine rhetoric and lore because there is no messaging from Department of Health around the importance of this. What do I hope that will happen? I hope that politics will get out of the way of public health. We have seen a prime example here with our terrible vaccination rates that when the Department of Health is not able to act the way it should and reaching out to the people that it is charged to protect, when we're not allowed to remind people that they should go back and get their second vaccine, when we're not allowed to even acknowledge that August is National Immunization Awareness Month, then we can't expect to have good outcomes for vaccinations. And what we'll see as a result is that people will continue to die in this state from COVID-19, which is a vaccine-preventable disease. There is no reason at this point why anyone should die from COVID-19 when there are effective vaccines that are safe and readily available.
I couldn't say it any better than you did just there, Dr. Fiscus. There is no reason why people should be dying from COVID-19 when there are vaccines that are effective, readily available. Thank you so much for coming on to talk with us today. We really appreciate your time.
Thank you so much for the opportunity.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.